Most cancer treats populations. It's a one-size-fits-all model. OncoMeta treats you. What if your treatment was designed around your DNA, your RNA, your spatial biology, your tumor map of your immune system? So then the custom medications are built just for you, microdosing so it doesn't have to harm you, and it helps make your immune system work better to fight cancer. And then it helps build your natural killer cells and dendritic cells to go after the cancer. This is the difference with proper precision targeting from a full ecosystem, not just some test. Hi, I'm Dr. Dino Prato, and for 2 decades, it's been my life's work and my team to build precision-targeted oncology at the next level, beyond the one-size-fits-all model or beyond just some integrative tests or off-the-shelf genetic tests, but an entire ecosystem to help patients. And today, I'm going to go through with you what that difference is. We call it OncoMeta, and it changes the game for cancer and for cancer patients forever, because I believe this is the way we get to solving cancer. Targets, data. That makes all the difference in the world. And how do we deploy them and how we build them? So the problem is, hope is not a strategy, but precision is. And conventional care follows the guidelines made up by the averages, the one-size-fits-all, NCCN guidelines, National Comprehensive Cancer Network, where 2 patients with the same cancer type and stage essentially get the same treatment. But that is just not true, because they're different. When you do the detailed testing, not just some off-the-shelf genetic test, but a full detailed map, you'd often start to see that the patients are on the wrong chemotherapy, they don't need the radiation they're getting, and even the surgery may not be correctly selected, because planning is just the beginning. It's how then we deliver the care that makes all the difference. So a lot of patients will do these things, surgery, chemotherapy, radiation, watch and wait, and then if the tumor adapts or comes back later. This is such a common thing. I'll give you a story. Patient comes to us. A year ago, she had a mastectomy done. So she had a lump in the breast, another tiny lump, and they decided to take it out because of the architecture of the breast. And then they did full-blows chemotherapy, and then went out and did some integrative lab testing and some integrative care to help her feel better about the care. And a year later, the tumor returns on the other breast. What went wrong? Everything. The whole process is archaic, because here there was no detail. So if we do the detailed testing, now obviously after that, we were able to help the patient with this method I'm talking about, and we were able to bring her into remission. And we do this all the time. This is not uncommon for us to see this in many types of stages of cancer where patients just don't have the right care. But let's go back and rewind that from the early stage. We would have froze that tumor. We would have needed to surgically remove it. We would have gotten the immune system targeted. Now that the immune system is targeted, often if we treat one side of the breast or one part of the tumor anywhere in the body, doesn't matter what type of cancer type it is, we would have seen it shrink in other areas of the body because the immune system is doing the work. It's called immuno-centric care. So when you give these high-dose chemotherapies, it wipes out the immune system. When you use these off-the-shelf tests, what are they going to tell you? Very little to nothing. It's a test that these laboratories can't sell to oncologists, so they bring them to the integrative doctors to use them. And there's not much they can do with them either, because they don't have the precision ecosystem. Drug design in the pharmacy, the delivery methods, the minimally invasive surgery, the monitoring. This is what it takes. You need the full ecosystem. Most integrative care is helpful. It's nutrition, immune support, but it has to be targeted. It has to have surgical precision, just like the oncology needs to be targeted. So this patient had no targeted chemotherapy, no targeted integrative care, and guess what happened? No surprise, the disease returns. Now, that's sad, because we don't want that to happen. We want integrative doctors to be successful. We want patients to be successful. We want conventional oncology to be successful, but they're missing it. They're missing it because they don't have the deep mapping. And OncoMeta, which what we've built over 2.5 decades in research and development, is you now can see the whole map. You don't have to guess. So imagine knowing what the blueprint is and then going in with exactly what you need, whether it's a nutritional deficiency or what's caused the cancer. Was it infection, chemical toxin, heavy metal? Was it Lyme disease? Whatever it is, you know what it is because we can see the immune suppression. Then what are the right chemotherapies for your type of DNA, your type of RNA? Now, I'm not talking about a few markers, thousands of markers, and most importantly, something called spatial biology immune profiling. This actually helps us to see the immune system, not just some blood test, but we can now do almost like a drone in the sky and see the entire cancer to tumor, all the immune system around it and what's blocking it, the cell types, the ratios, how many of them, the distance between each other, and remove the blockades and rebuild the immune system so it can go after the cancer. Now, you'll always hear me say the immune system is the key. We unlock the key to the immune system, your body can get rid of the cancer. That has been the secret for years. The immune system for most cancers, almost all of them, almost all solid tumors, is the key, because if the immune system can find the cancer, it kills it. And if it also does it at the microcellular level, when you see people get metastases or spread, it's because their immune system is being evaded, and we can change that. So tumor microenvironment is so important. Every doctor that works in the OncoMeta and our physicians are certified. These are experts trained to translate these deep maps. These are thousands thousands of data points. This is not some off-the-shelf test we took that we're going to run alongside standard chemotherapy. This is a custom drug design that goes from A to Z. Molecular tumor boards that get together with teams of doctors to discuss and train mapping for the patient. And that's designed and delivered with a systemic microdose care that's targeted. Now, why is that important? So sometimes you think chemotherapy is IV, but so little of the IV gets to the tumor. Maybe 5%, 2%. And in some fibrous tumors like breast and pancreatic, and there's a whole bunch of them that can be like this, esophageal, they can have these fibrous stromal barriers where 0.07%, very tiny bit, gets to the tumor. So in those models and in many cancers, we go direct to tumor using interventional radiology oncology, a catheter the size of the hair, but not with just some standard chemo, with these genetic targeted immune modulated therapies that are specific for you. Right to the tumor, we seal the blood supply, kill the cancer, and now create an immune system reaction so the rest of the immune system can identify the cancer and go throughout the body and get rid of the cancer cells, because that's the goal to long-term responses. You need to target the immune system. So align the drug, and we then, in that moment, when we do the testing, we can't just find medicines that are on label often. Those are drugs that are already approved for your cancer. We have to go to repurposed drugs, and we have to go to drugs that are off-label, meaning they weren't designed for your cancer, but they're the right markers for you. We go to integrative agents, phytotherapeutics that need to be used intravenously and built in our compounding pharmacies, custom for the patient based on their markers. And then we also need to build their immune system, their natural killer cells, dendritic cells, type them to the DAMPs, the damage-associated molecular patterns, all these fancy words, but it tells your natural killer cells exactly where to find the cancer and go after it. This is the data and the work to long-term signature responses to increase the efficacy of care significantly and lower toxicity. This is where oncology is going. This is what we've been doing for years, and it's called precision targeting. We're very excited, and I've said this before, and I'll repeat it again, because in 24 we published 35 times better response rates than conventional oncology for late-stage cancer and 43 times better quality of life. And that's with late stage. And we see those numbers go way up with early stage because we're catching it early. The sooner you use this type of precision ecosystem, the better, because this is not just some off-the-shelf genetic DNA lab where you're running a few markers or RNA. These are in-depth analytical maps, rapid formulations designed just for the patients, and then a continuous adaptive monitoring of circulating tumor cells, methylation scores, vesicles. These are leading indicators. Before we see tumor markers and imaging of tumors return, we can stay on top of it, help our patients hold remission. That's the goal of the work. And this is why it needs to be built on your biology and not guesswork. We don't guess, we measure, we design, we deliver, we adapt at the highest level. We've built one of the top precision targeting ecosystems in the world for cancer over 2.5 decades. You don't need more treatment. You need the right treatment. In fact, it could be a lot less when it's targeted. And it's important to incorporate this as soon as possible. Conventional only is the standard of care, and it's a one-size-fits-all, and it's a hit or miss. Sometimes the surgery can remove all the cancer, and the chemo may not have hit even the right targets, but because it got rid of it, it was supportive care. And sometimes you'll do chemo and get a percentage of shrinkage and the disease returns because the targeting is not correct. You'll try integrative care only, where you're getting support, maybe feel stronger and healthier, but the tumor is growing, or evasion occurs because the immune system wasn't typed correctly. But these are rarely done precisely, if at all correctly, because these tumor drivers continue to grow. So here's the problem we have. Patients are trying to find the right care, but they need the right precision ecosystem. It's about targets and drivers. You've heard me say it over and over again. Get the guesswork out, get the targeting going, and get more life. Well, that's because this ecosystem we've seen, we know is going to be the path to cancer, but we're way ahead. We're already doing it, and we're getting better all the time. And this is the care I believe every patient deserves. You need a custom designed program that is for you with an entire precision ecosystem. That's what OncoMeta is. It's an entire ecosystem from doctor to laboratory testing to treatment design and delivery to follow-up, where the immune system is the star of the show, because that's your body's ability to hold and maintain remission. Adapt for your true healing. This helps you to adapt in real time if you need care. So how does Meta work? Well, it delivers care in two ways: right care and the right timings. OncoMeta is really important. We have accelerated access so we can get patients that have cancers that have returned or are complex or need help immediately. We have an accelerated process for the mapping, the medication design, the treatment design, the delivery of care, and the follow-up. And then we dictate from there, the doctors dictate the care, the process, the follow-up, all done precisely for the patient. And it's all done with amazing care, concierge coordination, and removing all the barriers we can remove to help our patients respond rapidly to care. And that's important. And that's for patients that have rapid progression of disease, have resistance, they're in late-stage disease, and they need care now. That's the first pathway of OncoMeta. The second one is evaluation. These are for patients that may be in earlier stage disease, and they get their mapping, they get their planning, and they can see this pathway and compare it to the standard of care or the standard integrative care, whatever integrative care they're doing. They can map and compare the difference, and they're going to see the difference is enormous. What we're doing is far more detailed, far more comprehensive, with many more years of clinical experience doing this than just doing a one-size-fits-all modeling. So when you have this, you can coordinate the right care that's right for you, then can help guide you into the right treatment, into the right planning, and avoid a lot of the pain and suffering we see with oncology. It's cleaner, it's targeted, and it's not only genetics, it's transcriptomics genetics, it's NGS genetics, which are two different components, DNA and RNA, but then it's immune spatial biology with signature immune modulators. You're talking many thousands of markers, and then those are designed for you, not a few, many thousand, and then the treatment has to be made. The drugs have to be custom prepared because a lot of these off-label, repurposed need to be combined in the right timing and dosing, and that's where the physician training is so important and critical to quarterback the entire care. Patients who want a strategic, next-level personalized approach, this is the care, and this is where the one-size-fits-all model often fails. Why you don't see this everywhere? Personalized cancer care isn't a product, it's an ecosystem. It requires teams of people, data, research, work, pharmacy, laboratories. It all has to be in sync. It's not done by some little private practice or integrative care or done by a hospital who is already invested in the insurance billing model of standard of care, one-size-fits-all modeling and surgery. This has to be done in its own ecosystem, and it's very difficult to do because you need advanced expertise and targeting to accomplish that. This is what we've dedicated our life's work to. So I hope this started to help you understand the difference of understanding this and the strategies to design the right care for each patient, not off the shelf. And it's important that the medications are customly prepared and compounded for each person's unique formulations and then delivered in the right way, oftentimes using minimally invasive delivery. That is like a catheter the size of your hair. We go right into the blood supply of the tumor, right into the tumor where we can visualize it, deliver the genetic immunotherapy medicine, seal the blood supply to the tumor, kill it, and create an immune response to the body, and not getting the chemo everywhere else. I've said it many times. When you do IV chemo, maybe only 2 to 5% actually make it to the tumor. So where are the rest of it going to? Your organs, your healthy organs, your nervous system. And worse yet, with standard chemo, it's wiping out your immune system. So you're weak and fatigued. The very thing you need to fight gets destroyed. Where the treatments we build are designed specifically to strengthen your immune system, to teach your immune system through the DAMPs, through damage-associated molecular patterns, through markers, through antigens, neoantigens, exactly how to find and remove the tumors. That's the goal of the care. And immune-centric care is so smart because that's what your body does naturally to eliminate cancer, and it needs the right targeting to achieve that. So we have a dedicated team that monitors, builds the plans, works with our patients, evaluates the quality of the treatment plan specific for each individual patient. So what does that mean? Less guesswork, more life, fewer side effects, and a lot less guesswork, a higher quality of life and better care, because that's where cancer needs to go. We need people that can live their lives with great quality during cancer treatment, after cancer treatment, and understand what caused their cancer so we can also help them prevent the other horsemen, heart disease, diabetes, because oftentimes when you fix the metabolic and causative agents, you can help those other areas too. If you or a loved one has cancer and needs true personalized precision care and a roadmap, OncoMeta is unparalleled in the world, unparalleled with its infrastructure. And if you need help and you need it urgently, my team is always available to help you. You can reach out to our team, standing by to help patients. That's what we do. That's what we're dedicated to. Evaluate your program with one of the doctors, look and see what's going on, and see what can be done to help you. I'm Dr. Dino Prato. Thank you for joining me. May the Lord bless you on your journey to healing. And I hope this was helpful, encouraging, and giving you real information with real clinical experience after thousands and thousands of patients that we've treated, and not just some one paper that I'm citing or some theory, but real work that we've accomplished over 2.5 decades of building this ecosystem. God bless you.